Hi, my name is Isabella Rivera, and today I'm going to be talking about birth control and STIs. So first with birth control, there's 3 different methods that can be used: hormonal, barrier, or other methods. So for hormonal, there is the combination birth control, which is that there's a synthesis of progesterone and estrogen that is being consumed with consistent doses. Another method is the barrier method, which for an example would be the external condom to prevent any penile or vaginal contact. And lastly, there's other methods such as abstinence. This is completely getting rid of any contact, any sexual interactions as well. Okay, so for birth control, there's also chances of unintended pregnancies. So for the first method, the hormonal method, there is still a 6% chance of unintended pregnancy. And with the barrier method, there's an 18% chance. And with the other methods, such as abstinence, there's absolutely 0% chance of a result in unintended pregnancies. So the risks of these different types of methods of birth control are different. So first, for the hormonal, there is an increase in heart disease or heart rate with the combination of hormonal birth control, because in particular with women who are over the age of 35 and who were smokers, there's also an increased risk of breast cancer. And then with external condoms for the barrier method, there is no known risks at this time. And lastly, for abstinence, there is no risks whatsoever. STIs. So for STIs, I chose to talk about syphilis. And the actual scientific name is right here, Trichonia pallidum. Their pathogen is bacterial, and the way it is transmitted is by infection. So if you have cankers or infected sores here, that's how they can be transmitted, as well as through sexual intercourse or other interactions. As you can see here, it's like corkscrews. That's what they look like. Okay. And syphilis. So for symptoms, for most STIs, there's a difference between females and males and how these symptoms are presented. In this case, it is very general because it is very general. As you can see here in the image, it can cause fevers, rashes, or soreness of throat. However, the one distinction of a symptom that is just for females is that there can be stillbirth, or there can be early birth. They can have their baby earlier, prematurely, as well as their psychological symptoms, or if it's very drastic, you could also result in paralysis. Again, so talking about prevention, this can be prevented with antibiotics if caught early. As I said before, with the symptoms, drastic symptoms would be paralysis or psychological problems, because syphilis is considered to be a disease that is chronic. It is a chronic disease. There's not a lot of prevention other than just antibiotics if it is caught early. And this is my work cited. Thank you.